Good morning and welcome to our policy forum this morning. It should be a very interesting day. And this is the hard part, getting people to sit down and be quiet. You guys are fooling me this morning. They actually did. I'd like to introduce Alfredo Aguirre, who is the Behavioral Health Director of San Diego County.
Good morning, everybody. Welcome to Carlsbad. As you can see, I know the weather's giving you a really hard time. And I see that's just going to remain the same through the weekend. So anyway, I have the honor this morning to introduce a couple of leaders for the county of San Diego who will also then offer welcoming remarks. And they're particularly popular here in North County, and as they talk, you'll understand why. First, I would like to introduce Bill Horn. Bill Horn is our 5th district, which is Carlsbad is part of. He's the current chair of the board. And Bill knows San Diego, especially North San Diego County. A native San Diego and North County businessman and avocado rancher, Bill has earned a reputation as a champion for private property rights and fiscal responsibility in government. When he was elected to the County Board of Supervisors in 1995, the County of San Diego was on the brink of bankruptcy. Today, it has earned a national reputation as one of the best managed counties in the nation. Bill graduated from San Diego State in 1966. With America at war, Bill enlisted in the Marine Corps. He was commissioned as a 2nd lieutenant and was sent to the jungles of South Vietnam. There he led his men as a commanding officer and was recognized for his extraordinary heroism with numerous decorations, including the Bronze Star Medal and the Purple Heart. Bill serves on more than 25 committees in San Diego County, providing leadership in the areas that include housing, health, land use, water quality and supply, public safety, economic development, education, and transportation. Please join me in welcoming Chairman Bill Horn.
Well, good morning. Thank you for coming, and welcome to Carlsbad, beautiful Carlsbad. This is part of my district. What Alfredo didn't tell you is 4 years prior to becoming on the Board of Supervisors, I sued the county over a land use issue. And I decided it was cheaper to become one of them rather than continue to pay a lawyer. So anyway, as a county supervisor representing North County, and I was born and raised in this county, and I'm 72 years of age. The only time that I was out of the county was in the Marine Corps for 5 years, and when I worked 3 years in Israel. And so this is a beautiful county. Only thing we're missing here is your tourist dollars and some rain. We could use an awful lot of rain. And listening to the weather this morning, I see they're going to have a huge hurricane over in the East Coast. So hopefully we won't get anything like an earthquake or whatever. You can enjoy your weekend. Anyway, Carlsbad is a wonderful district. We actually have an airport here that can take you wherever you'd like to go. We're very fortunate to have that. My district is 1,860 square miles, which is bigger in some cases than most in the United States. Actually, I'm bigger than the state of Rhode Island just in my district alone. So that's huge. There are 615,000 people who live in my district, and we're often compared or overlooked because of the city of San Diego having 1,100,000 people. But I have to point out to folks from Del Mar and Poway, which are 2 cities in San Diego County, north, we have 1,200,000 people. The difference is they're all separated out in 5 different cities and what have you. So that's important. My district stretches all the way from the coast, all the way to Imperial County, Borrego Springs, and Anza Borrego National Park. So for those folks, about 35 communities, I'm their mayor and their city council, and everything that happens wrong, they talk to my staff about it. Anyway, I was elected in 1995. As I mentioned, As serving as the chairman of the Board of Supervisors, this is my 5th time. I've been on the board for 21 years. I always wanted to have, and we have term limits now, so I'm out of here in 3 more years. But I've always wanted to make the veteran part of our activity. So this year I declared this to be a Year of the Veteran. And I want to tell you about some amazing things that the County of San Diego has done. One of the issues, I would say problem, one of the opportunities we have is we are one of the highest concentrations of active duty and retired military in the country. 1/3 of the San Diego County's population, 3.3 million people, are former military or their families. That's a lot of people. And so, as it was pointed out just a week ago, the military in San Diego County spends $27 billion. That's a lot of money. And we're hoping to get another aircraft carrier, which is $1 million a month payroll, period. So we're hoping to get a 3rd aircraft carrier in our harbor. But that means that we have a huge opportunity. I guess I'll let Alfredo mention the opportunity. We have a network for Health and Human Services that includes military families and the military. So part of our opportunity, I guess I would say this year, is to provide for them a facility and programs to address a lot of their needs. So last week, I was very proud to open the Military and Veterans Resource Center here in Escondido. It's fantastic. It's a one-stop shop. It provides an array of services for everything you would have on health services, all the way over to helping these guys transition out of the military, finding jobs, finding housing, what have you. And a lot of people think of just the service person getting out of the service. You have, in most cases, spouses, children to consider. So that's another area that I'm pleased that the County of San Diego has moved into to provide employment assistance, counseling assistance. You know, we also have a program in San Diego County, which we started last year. It's called the Courage to Call program, and it kind of fits into what your whole philosophy is here. It's a 24/7 helpline. It's really unlike any other because it helps these veterans with issues contact other veterans who've been through it. And so that's really extremely important. And I'm really happy with this program because you can go to you can call it from any location, but you can go to any one of our public libraries, go on the computer, connect with folks. That's really important for us to get to them and to let them really be mentored by a peer group. You know, somebody who's been there and somebody who's been in that situation. Especially if it's good for families. You get a lot of spouses who really, you know, the husband or the wife, whoever was in the military, is not communicating with the other person. And now they're in a whole strange new situation. They're from Nebraska and they now live in San Diego. And what are they going to do next? So it's really an important issue for us to help these people transition. We also have another program called 0800. It's a military transition support program. It's very important. The definition of a whole care that we can provide to them, because the program links active duty military families to comprehensive wraparound services that the community has available. And before they leave the military, helping them make that first step as a transition into their new life. And you know, I'm a former Marine. We were trained to kill people and break things, and so that doesn't really fit in too well. If you'd like to know, you can talk to my sheriff. He's got a jail full of those kind of people. And so it's important for us to transition. I know because I went through it. I happen to be very fortunate. I was a Marine Corps captain when I came out of the service. But, you know, I spent 14 years with nightmares and cold sweats and what have you. And it wasn't about the people I killed. It was about the people that I knew that died. my friends. It took me a long time to make friends because when I had friends, they'd get blown up 3 weeks later. So that's a big issue. And that's an issue these kids, man or woman, who Afghanistan, Iraq, what have you, these people have served your country, and I think we owe it to them to help them make this successful transition. Anyway, we're working to establish 2 crisis stabilization units here in North County. I picked North County because I have Camp Pendleton, the largest military installation in the country, right here. And sometimes it's vacant because they're deployed, but most of their families are here. And so we're very proud to be doing that in the county of San Diego. And I'm really pleased with the county's operation. As Alfredo said, we were almost bankrupt 21 years ago. Today we're the most solvent county in the country, actually the most solvent government in the country. And so I'm pleased to see that our resources are going into people's lives and making a difference. So thank you for allowing me to share some of my programs with you. And for those who voted for me, appreciate it. And so you're going to hear from Nick in a minute, but Alfredo, you're back. Thank you. And it's not that I don't want to hear them, but I'm doing court in Vista in about an hour.
Thank you, Bill. Next to greet you, we have Dr. Nick Yphantides, known affectionately as Dr. Nick. He is an advocate for those in his community who need it the most. He currently serves as the Chief Medical Officer for San Diego County and its 3.2 million residents. He is the founding co-chair of San Diego's Childhood Obesity Initiative, was the Chief Medical Officer of one of the largest network of community clinics in San Diego County, which was the Council of Community Clinics, and was the publicly elected chairman of the board for Palomar Health, the largest public hospital district in California. He is thankful for the fact that he has never seen a patient with private insurance in his life. That's true. As a result of his personal health transformation, he now advocates for population health transformation. Dr. Nick is a cancer survivor and has been to as many countries as his age. His daughters, Veronica and Zoe, are the joy of his life, and they make their home in Escondido, California. So, Dr. Nick, thanks for being here.
You promised that you weren't going to read the blah blah and just tell them that we're baseball compadres and hermanos. Good morning, everybody. Good morning. How the health are you doing? What the health is going on here today? I have a little bit of a irreverent, if not joyful attitude. I didn't realize that it was in that bio, but today actually is a momentous personal day in my life. It was 18 years ago today, right at this moment actually, that I was filleted open on a surgery table, undergoing massive surgery for what I did not think was going to be a curable cancer 18 years ago. And so there is a little bit of irreverence and informality and transparency when you've been to the edge and come back from it. And so I stand before you today with a tremendous attitude of gratitude and sincere appreciation for what you are doing and what you are promoting. You know, it was mentioned, for my whole life, and it is something I'd like to acknowledge as perhaps not something I'm proud of, but I'm thankful for. I spent a lot of my life serving the people in our community who needed it the most. The homeless, the undocumented immigrants, the seriously mentally ill, those without any resources, many of whom, unfortunately, my colleagues were not willing to see with a 15-foot stethoscope. And yet, that is who I committed my whole life to. And as being somebody who has spent the majority of his life exclusively in the quote-unquote safety net, we did a lot of innovation in terms of integrating behavioral health into the primary care environment. And one of the things that's happening now that we are promoting is actually integrating primary health care into the behavioral health environment. It goes both ways, ladies and gentlemen. And so I'm excited to hear that there was a whole meeting focused on whole person approaches and integration. You're going to be discussing a lot today about the waiver and the upcoming 115 waiver effort here in California. Our county, our community has been very involved. We actually had a whole process in place mobilizing health systems, health plans, behavioral health providers, physical health providers, homeless providers, primary care clinicians that came together multiple times that actually drafted some specific recommendations that hopefully will be considered. The last thing I want to say is for us, and you heard from our chairman who already left, a little bit of the effort that we have going on with veterans, something that he obviously is passionate and proud of, being a veteran himself. But that is but one of many activities that we are fortunate and blessed to be pursuing regionally, because we have a strategic vision we call Live Well San Diego. And Live Well San Diego is something that our Board of Supervisors actually formally adopted as a priority. It was initiated by the Health and Human Service Agency, but it has now become the mantra and the rally cry of our entire county enterprise, as well as our community, and that we have well over 120 now formal Live Well San Diego partners, from hospitals to not-for-profits, to faith-based communities, to behavioral health providers. And the three core tenets are about building better health, the obvious thing, but for us it's not about reactive sick care, it's about proactive health care. And we also embrace the notion of safety. We are an agency that is pursuing being trauma-informed, trauma-marinated in terms of our interaction with our community as we understand more and more the environmental, if not the genetic impacts of early life trauma. And so we look at things from the perspective of safety, and yet we also have the third component we call thriving, which is really all about addressing the challenge, which obviously has been front and center even at the national level, of social and racial inequity. And so Live Well San Diego is our framework, and I'd love to share one number with you all that I would hope you'd remember, and that's our rally cry. We call it 3-4-50. There are 3 human behaviors, should come as no surprise: physical inactivity, unhealthy diet, and smoking. Those 3 modifiable, preventable human behaviors are the primary causative factors of 4 chronic diseases: heart disease, cancer, diabetes, and pulmonary disease. 3, 4, and the 50 is over 50% of the deaths in our nation. Here in our county, it's at about 53%, are caused by those 4 illnesses. 3 behaviors causing 4 chronic conditions that account for over 50% of the death. And one of the realities that we are facing, folks, is that those 3, 4, 50 numbers, when it comes to dealing with folks who have behavioral health challenges, unfortunately, as you well know better than I, it is disproportionately affecting our patients that we are concerned about. And so we have a mandate, we have an opportunity, we have a stewardship challenge to be able to advocate for whole person care, integrated care, not just bringing behavioral health into the primary care setting, but also primary care into the behavioral health setting. So I commend you, I appreciate you. This is something near and dear to our hearts collectively and to some of us individually. So blessings upon your efforts today, and welcome to San Diego. Really appreciate you being here.
Sandra, I think you'd come back up. As you can see, we're very lucky to have Dr. Nick in our county.
I'd like to ask the presidents of the various associations that sponsor this event to come on up. And thank you. That was a great presentation. Really appreciate it, and appreciate how you've spent your life. It's great. Okay.
So hi, good morning. I don't think I can be as enthusiastic as Dr. Nick, but I'll try. Welcome. I'm Mary Hale. I'm the Behavioral Health Director for Orange County and the current president of the County Behavioral Health Directors Association of California. We all have new names. We tried to keep our acronym close. We're CBHDA, and on behalf of CBHDA, thank you, Alfredo, Dr. Nick, and Chairman Horn, who left, for allowing us to be here in beautiful Carlsbad in San Diego County. The weather could not be any better. I know we all want rain here in California, but sort of selfishly, it's kind of nice that it's not raining right now. Don't tell anyone that I said that. It is great to be here, and really, Dr. Nick, you laid it out so well, the goals of whole person care, of integrated care. Always at our policy forums, it's the folks that come are from counties. We have our providers and our providers associations. We have families and individuals that are living with behavioral health conditions. And then all of the other folks that are here as advocates, as policymakers. And we all have the same goal. We all want those individuals who have a substance use disorder or a mental health disorder or both to have a better quality of life. And for years, we've been talking about how to do that. We talk about integrating, whether it's integrating mental health and substance use or physical care and going both ways, as was just presented to us. And how nice today that we have this policy forum focusing on whole person care, bringing that vision to life, putting it together. And we all want to do that. And so today you'll get to hear from all of those groups that I just talked about, plus folks at the federal level that are going to tell us about some of the things that are going on there, the state. And so I welcome you, and I hope and trust that you'll learn lots today and be able to take it back to your respective communities. So thank you for being here.
Good morning. Dr. Nick, that was inspirational. I'm so glad I didn't have to follow you and that Mary got to go first. Hi, folks. My name is Darrell Evora. I am the CEO of EMQ Families First, and I'm the current president of CCCMHA, which stands for California Council of Community Mental Health Agencies. We believe tomorrow to soon be California Council of Behavioral Health Agencies once we have our membership vote. We are an association that is 70 members strong. We serve over 300,000 children, adults and older adults all across the state every year. We collectively have 21,000 full-time staff, and that number isn't particularly important apart from the fact that all of those folks, along with myself, are committed to partnering with you to make sure that those we serve are served by a comprehensive, responsive, and integrated behavioral health system so that they can enjoy fuller and more productive lives. We're committed to partnering with you to do that, and we're proud to be here as a co-sponsor today. And on behalf of all those that we jointly serve, welcome. Have a great day.
Good morning. Al Senella, President of the California Association of Alcohol and Drug Program Executives, and President and CEO of Tarzana Treatment Centers. And look, all my state friends right here in front of me. Good morning. I like to have them close. I will be brief. I just would like to talk a little bit about the association that has a name of representing substance use disorders. But understand the membership is made up of providers that are also known primarily as mental health providers and known as primary care providers, and those that just specialize in substance use disorders. The conference here today about integrated care, whole person care, is an easy item for all of us to talk about. We do a good job talking about it. It's a much more difficult task to implement. And the difficulty varies whether you're trying to do something within primary care, mental health, or substance use arenas. And the ability varies in those three arenas. The huge plus that's coming forward in the substance use arena, the drug Medi-Cal system of care that was approved through the waiver, is a massive opportunity for the SUD field that's never before existed. I'm just not quite sure everybody feels the same urgency I feel about getting it live today, kind of thing. As we sit and talk, day after day about what we need to do to implement it, and it's a very complicated thing to move forward and implement, continued waiting lists, continued people dying from overdoses, particularly the opiate epidemic that we all are becoming so familiar with. And so I every day feel an urgency to let's do it now kind of thing and work out some of these problems along the way, not trying to get it all perfect before we go live kind of deal. I have a particular interest in the 1115 waiver, the broader waiver. I think it brings a lot of new opportunity for the integration that we're talking about today. I'm concerned about how that will pan out ultimately because of things that have been going on with the negotiations. The shared cost savings, which was part of the proposal that California made, has been taken off the table, and with that, of course, a lot of expected revenue would go away. The battle over the health plan tax that could remove $1.1 billion from the system is also a scary debate that's going on. And those things, ultimately, if they continue on that path, will impact what we're able to do overall because of resources being tightened up. Another big change that's underfoot that I'm not sure all of you are aware of, I hope you are, is the big change that's going on with the California Department of Corrections, revamping what it wants to do with its substance use disorder services as part of embracing the drug Medi-Cal system of care that's unfolding, the waiver services that are unfolding, which brings a lot of new challenges to counties because you got the Medi-Cal card in your pocket. Well, counties are responsible for what comes with that. Which is a real change for that population. And so there's going to be a lot of work that we need to do around that in terms of coordinating it. And lastly, there is Prop 47 that I think many of us are staying close to and hopeful that it will ultimately help our systems of care. There are lots of talk about a marijuana initiative to legalize marijuana that most folks would not like to see happen, but if it happens, we want to try to get out of that some good things with whatever tax revenues are generated for our systems of care. And there's a piece of legislation that's kind of moved into a 2-year bill that really talks to a big step forward in our workforce that I think we should all stay close to for recovery support, peer support counselors, and creating a certification program for that group of workers that would, one, raise the bar, and two, create a much better set of services to the populations that need that kind of help. Thank you.